Hello, my dear students. Today we are going to discuss the beginning of humerus. There will be one more lecture on humerus. I want you to take this at a comfortable pace. Remember, it's an important bone. You must understand it well. I am Dr. Vaishali Bharambe. I've been teaching anatomy for more than 25 years and I continue to find this subject very beautiful. I hope you do too. I have a request for all of you. Please sit in for this class with a humerus in your hand. Better still, keep a scapula and radius ulna also with you. Remember, all these bones have to be of the same side, otherwise you will articulate the wrong bones and really confuse yourself madly. So keep the bone in hand and let's begin. I will be asking you a lot of questions throughout this session. The answers to all these sections are available in the notes section. Please comfortably access it there. So let's begin by asking ourselves the question, where is the humerus? The humerus is the bone of your arm, this bone or this bone. So palpate on yourself the following. Now don't think this is optional, not at all. If you don't know your body, you have no business going around charging for palpating somebody else's body. Sounds very horrible, but it's a fact. You must know your body first. So let's begin the activity. Feel the upper end. Feel the upper end of your humerus here. Feel it articulating with the scapula. Feel your scapula. You should be able to feel your scapula. Feel the lower end. You can feel the bony lower end of the humerus easily. Feel the medial epicondyle. Now go on the medial side. Can you feel a bone projecting medially? That's the medial epicondyle. Similarly, on the lateral side, you will feel another bone, lateral epicondyle. It's important that you feel these important parts of humerus on your own body. That way, when you study the bone, you find it to be more familiar. Okay? So if you've done the activity, let's begin something else. I'm going to talk about different parts of humerus. So now is the time when you should pick up the humerus and let's begin to discuss this. Okay? So hold the humerus in such a way that you can see that it has a rounded head and a lower end. First, let's focus our attention on the head end of the humerus. The upper end of the humerus shows presence of a head, a lesser tubercle and a greater tubercle. This is the head, the lesser tubercle and the greater tubercle. Familiarize yourself with the bone. If you're done with the upper end, let's now go to the neck. So what are the parts of the neck? The humerus has 3 necks. So let's talk about the neck of humerus now, okay? So if you can see as you run your hand on the head, you find at one point it just shows a little depression. This depression is called as the anatomical neck of humerus. What is it called? Anatomical neck of humerus. Now, if you go a little further, imagine a line which is passing through the lesser and the greater trochanter horizontally. Okay? Passing through the lesser and the greater trochanter, something like this. This is called as the morphological neck, which is not visible. It's a developmental concept. You have to understand it. Towards the end of humerus, you will understand it. Now let's talk about the surgical neck of humerus. Just pick up the humerus and suspend it like this. This narrow portion of the humerus, which connects the head with the rest of the shaft, is called as the surgical neck of humerus. So, anatomical neck, morphological neck and surgical neck. These are the 3 necks of humerus. Let's now talk about the shaft of humerus. Shaft as in this entire length. Shaft as in this entire length of humerus. The shaft of humerus has 3 borders and 3 surfaces. I'm going to show it to you and I will repeat it again when we are doing the borders and surfaces. Just understand that here between the lesser and the greater trochanter there is a groove. This is called as the bicipital groove. Okay, were you to run your hand downwards from the groove, okay, this becomes the anterior border of the humerus. From the medial border of the bicipital groove, were you to run your hand downwards, you will find that it goes medially to the medial supracondylar ridge. This becomes the medial border. From the lateral epicondyle, if you run your hand upwards, this is the lateral border. So anterior border, medial border, and the lateral border. Therefore, anterior surface, three surfaces, medial surface, lateral surface, posterior surface. Let's do this once more. Anterior border, medial border, lateral border. Okay, three borders. Medial surface, lateral surface, turn it around, posterior surface. Three surfaces, three borders of humerus. Let's now go to the lower end of humerus. Remember, hold the bone correctly and vertically. At this stage, you don't know which side it is, but till even then, remember to hold it vertically. Now, let's talk about the lower end of humerus. Okay, so the lower end of humerus has an articular part and a non-articular part. So, if you look at it carefully, there are parts of the humerus which are smooth. These are articular parts, and parts which are rough. These are non-articular parts. Okay, so you can see that these articular parts, you can see a rounded body here called the capitulum. You can see something like a, like a pulley called the trochlea. Okay, so capitulum and trochlea articulate with the radius and ulna bone respectively. Above that, you can see depressions. There is a coronoid fossa here, there is a radial fossa here, and you are seeing an olecranon fossa here. We will be discussing all this much more in detail later, but we've got our basics in place now. Why have we done this brief introduction to humerus? Let's understand. So now we go on to normal anatomical position of the bone. We know that the head end is superior. The head is directed upwards, backwards, and medially. The flat end is inferior. This contains the trochlea and the capitulum. These have to be directed inferiorly. So superior and inferior are done. What should I place medially? Can I hold the bone like this? Can I hold the bone like this? So remember, go down. Go to the lower end. This is your medial epicondyle, the more prominent of the two epicondyles. This epicondyle is more prominent than this one. This should be directed medially. The medial epicondyle, the more prominent epicondyle, should be directed medially. The less prominent epicondyle should be directed laterally. So superior, inferior, medial, lateral are done. What about anterior, posterior? Remember, posteriorly, the humerus shows a deep fossa called the olecranon fossa. Can you see the fossa here? This deep fossa should be placed posteriorly. So, olecranon fossa posteriorly, bicipital groove anteriorly. So now my bone is in the correct anatomical position. Yet, I don't know which side it belongs to. Now look at the head. The head of the humerus will point to the opposite side. This head of humerus is pointing to the left side. Therefore, this is the right side humerus. Remember, the head of the humerus points to the opposite side to which the bone belongs. This head of humerus is pointing to the left side. Therefore, this is the right side humerus. Understood? So you have to practice this. Practice your normal anatomical position of bone. Practice your side identification. And then let's begin the journey of understanding the humerus much better. Alright? Let's begin studying the humerus some more. I suggest you pause the video, practice side identification and normal anatomical position once, and then take it forward. Let's now begin the journey of understanding the humerus better by studying the upper end. As we know, the upper end is made up of head, lesser tubercle, and the greater tubercle. Right. So here you are seeing the head. This is the intertubercular sulcus, the head, the greater tubercle, and the lesser tubercle. Familiarize yourself with these very important parts of the head end, and let's continue. The upper end of humerus shows presence of a head here, a greater tubercle here, a lesser tubercle here. You know this. And you can see that This head forms 1/3 of a sphere. This head of the humerus forms 1/3 of a sphere. It is directed upwards, backwards, and medially. Hold the bone in its normal anatomical position throughout the video. I can't hold it because I'm teaching you, but you should be sitting like this with the bone held in its normal anatomical position, olecranon fossa pointing directly towards you. That's the only way you will understand this bone correctly. So the head of the humerus is covered by a hyaline cartilage. How is this hyaline cartilage? If you recall, I have taught you earlier, but I'm going to teach you this again. Whenever there is a convexity, okay, the hyaline cartilage is thick in the center and thin at the periphery. So in this case, now this is a convexity, right? So the hyaline cartilage will be thick in the center and thin at the periphery, increasing the curvature of the bone. Remember, if it's the other way around and the curvature is a concavity, the concavity will be the hyaline cartilage will be thin in the center and thick at the periphery, increasing the concavity or increasing the convexity. That is the job of hyaline cartilage. So here you can see the head of humerus covered by hyaline cartilage such that it is thick in the center and thin at the periphery. Here's your hyaline cartilage separately colored for you to understand. 1/3 of the humeral head comes in contact with glenoid cavity anytime during articulation. I want you to pause and pick up that scapula of the same side. Okay? I'll also pick up a scapula and let's articulate the head of humerus with the scapula. So as you can see, this is the scapula and this is the glenoid cavity. You can see how shallow the glenoid cavity is. Now put the humeral head and let it articulate with it. And this, you can see how the head is naturally pointing downward, upwards, backwards, and medially to articulate with the scapula. And together they form the shoulder joint. This articulation is important for you to practice so that you know what is flexion, what is extension, what is abduction, what is adduction. All this is happening at shoulder joint. Practice this articulation. Okay, so now we understand how the head of humerus covered by articular cartilage, which one? Hyaline cartilage, and the glenoid also covered by hyaline cartilage together articulate to form the shoulder joint. So what is angle of humeral torsion? Again, find out the answer. You will find the answers in the notes section or on my website. Let's talk about these tubercles. I told you there's a lesser tubercle, there's a greater tubercle, right? Palpate the lesser tubercle on the bone you're holding in your hand. Here is your lesser tubercle, palpate it. Medial side of bicipital groove, okay? Now, the lesser tubercle gives attachment to a muscle called subscapularis. Now understand that your subscapularis take attachment from the costal surface of scapula to the lesser tubercle. Okay, from the costal surface of scapula extending to the lesser tubercle is your subscapularis muscle. When it contracts, it just pulls the humerus closer. Let's practice this. This is the costal surface of scapula. This is the lesser tubercle of humerus. Between the two of them, across it extends your subscapularis muscle. When it contracts, it's going to pull the humerus medially. When it contracts, it's going to pull the humerus medially. Unless you practice this, you will never understand movements at shoulder joint. Pulls the humerus medially. It can also pull the humerus. It can also pull the humerus this way, adduction. Okay, please practice all this. Right. So we've understood the subscapularis muscle. Practice the action of the muscle by articulating the scapula and the humerus. We've done that. Let's talk about the intertubercular sulcus here, between the lesser and the greater tubercle. This is the intertubercular sulcus. So take a look at it here, okay? We've zoomed in now. This is the intertubercular sulcus. You can see that between the greater and the lesser tubercle, across it, a ligament has appeared. This ligament is called as the transverse humeral ligament. Okay, it breaches the gap between the two tubercles, creating a tunnel below them. Through this tunnel passes the tendon of biceps brachii. Okay, pick up the humerus that you have and take a look at it. So here you are seeing a lesser tubercle. Here you are seeing the greater tubercle. Just put your finger over them like this. Can you see that there is a little tunnel formed? Attaching greater to lesser tubercle results in formation of a tiny little gap. Through that tiny little gap, the tendon of biceps brachii passes. The long head of biceps brachii passes through the gap between the lesser tubercle and the greater tubercle. This gap is breached by the transverse humeral ligament, which passes over the long head as seen, holding it in place. Now let's move on to talk about the greater tubercle. Remember, lesser tubercle, attachment of subscapularis. Intertubercular sulcus, transverse humeral ligament, long head of biceps brachii. Now let's go to the greater tubercle. The greater tubercle has three facets on it. Okay, superior, posterior, and more posterior. How do we understand this? Can we see them clearly? Let's take a look to understand. Now here is your greater tubercle. Here, seen anteriorly, seen posteriorly. You can see that it is showing three muscles attached to it. These are attached at the three facets. Pick up the humerus again. So now let's look at this part of the humerus. Okay, this part is the greater tubercle. It shows a facet here, shows a facet here, and shows a facet here. They are not exactly three clearly visualized facets, remember. But this whole thing is a greater tubercle, and broadly speaking, it shows you these three facets. Why do they matter? Why are we discussing these three facets? Come back to the screen, I'll explain it to you. So here you are seeing subscapularis, familiar territory. We know it is lesser tubercle. But here at the top of the greater tubercle, you find the attachment of a muscle called supraspinatus. Turn the bone around. Supraspinatus, infraspinatus, teres minor. Three muscles which are attached to the greater tubercle of humerus. Okay. Now this is extremely important. These muscles, along with subscapularis, together form what is called as the rotator cuff muscles. I'm sure you've heard of what a rotator cuff. Just imagine that there are four muscles which are literally gripping your shoulder. And I'm going to show this to you. Imagine these are my muscles. They are gripping my shoulder. They are literally supporting my shoulder from anterior, superior, and posterior, preventing this rather shallow joint from dislocating. They are called as rotator cuff muscles. I'll show you a better diagram to give you an understanding. Now, this is a section through the shoulder joint. Here is your glenoid cavity, and the green line indicates the capsule of shoulder joint. Now observe. This is teres minor. This is infraspinatus. This is supraspinatus, and this is subscapularis, surrounding the shoulder joint from posterior, superior, and anterior, thus supporting your very shallow, very unstable shoulder joint, preventing dislocation. Rotator cuff muscles are indispensable for shoulder joint stability. If somebody has a problem with shoulder joint, more likely than not, it is a rotator cuff injury. Right. So we've covered the upper end of humerus. Let's now talk about the neck. Remember, I told you there are three necks to humerus: a surgical neck, a morphological neck, and an anatomical neck. I'm going to start the discussion by talking about the anatomical neck. One more activity. So like I told you, the humerus has three necks. This narrow constriction around the head is called as the anatomical neck. The point where this entire bulbous head region reaches the shaft, where you can literally suspend the humerus, this is the surgical neck. And imagine a line passing through the lesser and the greater trochanter obliquely. That is the morphological neck, which we cannot see in this bone, but can be seen on X-rays in younger children. So anatomical neck, surgical neck, and an imaginary line passing through lesser and greater trochanters is the morphological neck. If you've got the necks, let's come back to the screen now. Anatomical neck, surgical neck, morphological neck. We've got it. Let's look at this anatomical neck and then let's wonder, why are we discussing it? So understand that Just at the anatomical neck, can you see this green dotted line here anteriorly and posteriorly? This is the attachment of capsule of shoulder joint. So this is the anatomical neck, this is the surgical neck, okay, and this green line is the attachment of capsule of shoulder joint. As at the point where the surgical neck is present, you will find that there are axillary nerve and posterior circumflex humeral artery related to the bone. Now, can you imagine a fractured surgical neck humerus? Will you not have a patient with an axillary nerve injury? So, every time we study a bone, it's important to imagine its pathology and understand how the pathology occurs. Okay, so surgical neck of humerus is related to axillary nerve and posterior circumflex humeral artery. Therefore, fractured neck humerus results in axillary nerve injury. Right. So here it is. This is the fractured neck humerus, and you can see that the axillary nerve and posterior circumflex humeral artery will be damaged. Right. So this line that I have been talking about, morphological neck, it's 0.5 centimeter above the surgical neck, almost passing through lesser and greater tubercles. Okay, it's called as the epiphyseal line, which is joining or which is present between the epiphysis and the diaphysis of humerus. It's the epiphyseal line. Fusion of this line will take place at an age of around 20 years. We will discuss this quite a bit in the next part of this lecture. Okay, so let's talk about the capsule. Remember the green line I spoke about? Right. So the capsule, no discussion of humerus can be complete without discussing relevant parts of shoulder joint. So here you're seeing a section through the shoulder joint. This is the glenoid. This is the head of humerus. This green line here is the capsule, which as you can see is attached to the anatomical neck of humerus superiorly, and inferiorly it seems to be just dipping down a little. So it is attached along anatomical neck except at the bicipital groove, it shows a gap. For whom does it show the gap? Of course, it's for the passage of the long head of biceps brachii, which is an intracapsular tendon. On the lower aspect here, you can see that the capsule is attached slightly lower down. It's not attached to anatomical neck. It's almost a 0.5 centimeter lower down attachment. Because of this laxity, it's very possible for the head of humerus to depress downwards, to dislocate downwards. Let me show you this by articulating the humerus and scapula again. So this is the scapula and the humerus articulating together. You know that the capsule of shoulder joint is holding them together well anteriorly, superiorly and posteriorly. But inferiorly you saw how the capsule is slightly lax. Now what happens? Supposing you were to abduct the humerus, inferiorly it's not adequately supported, so it can dip down, causing an inferior dislocation of shoulder joint. Let's do this again. You have started to suddenly abduct your shoulder, and because it is not inferiorly supported well, the humerus can dislocate downwards. So that is the importance of knowing the capsular attachment of shoulder joint on the humerus. So now here you are seeing the intracapsular tendon of head of bicep brachii descending downwards. Okay, thus it is piercing the capsule. Remember I told you the capsule is lax inferiorly and capsule is absent over the bicipital groove, which leaves a little gap here for the exit of intracapsular tendon of head of bicep brachii, and it's held in place by a ligament. Try to remember the name of the ligament, the transverse humeral ligament. Thus the biceps tendon is held in place as it passes through the bicipital groove. So with this we are going to stop. We are done with the head end of humerus. We have talked about the neck of humerus. In the next lecture, humerus part 2, we will be discussing the anterior border, posterior border, surfaces, lower ends and so on. So what did we learn today? We learned features of humerus, side identification, anatomical position, normal anatomical position. Then we spoke about the upper end, Head, lesser tubercle, greater tubercle. Neck, surgical, morphological, anatomical. Now in the next lecture, we'll be talking about the shaft and its borders and surfaces, the lower end, articular and non-articular. I'm really looking forward to discussing this part of the humerus also with you. Meanwhile, I've asked you a lot of questions and you will find the answers in the notes section. Thank you. I like taking this lecture and I'm eager to see you across the screen in Humerus Part 2. Bye.